Hi, I'm Dr. James R. Fedich. I'm the clinic director at Village Family Clinic in Hackettstown, New Jersey. Here to answer some commonly asked questions about health problems, and today we get a lot of questions about neuropathy. So we have a lot of patients with neuropathy. Neuropathy just means nerve damage or pathology of the nerves technically. So a patient mostly asking about neuropathy in the legs. So what we remember from third grade anatomy is that most people have a brain up top, spinal cord down the middle, nerves going into the legs. So neuropathy, typically people talk about in the legs, we can also get in the hands. When they're usually talking to us in our setting, there's a couple reasons we get neuropathy. So one of the common reasons is actually diabetes, a diabetic neuropathy. And what that means is that the blood sugar is actually affecting the nerves and causing them to kind of die off a little bit and not work as well. So we get the numbness, burning, and tingling in their feet. Now you can also get neuropathy from chemotherapy. It's the same as the diabetes. The chemo damages the nerves in the legs, and you get diabetic neuropathy, as well as the chemo neuropathy, and that feels the same. You feel the burning, tingling in the feet. You might not be able to feel things as you walk. One of the more common ones that we see in the office, one of the most common causes we'll see is more of a stenosis-based neuropathy. So what that means is that the nerves in the lower back that are coming through this tunnel here, they're going to come through a tunnel called the central canal and then split off and go down to the legs like we talked about. As we get older, it doesn't matter how healthy we are, that tunnel slowly gets a little bit smaller over time. And if it gets small enough, it starts pinching the nerve as it's going down into the legs. So it's the analogy I give people, it's kind of like a garden hose. The water's coming down the spigot, down to the front lawn, but there's a little kink in the hose. And as we get older, that tunnel can start closing down for us. That's one of the most common causes. I'm going to go over a couple different ways we can treat you, and Maria's going to follow me with the camera. We're going to walk across the office. This is one of the examination rooms to give an explanation. We're going to follow us to the treatment side of the clinic, where I'll show you a couple different options for neuropathy. So in this room, our spinal decompression room, we have two spinal decompression tables, as Maria's shown you. And what these can do is, if it is coming from the lower back, they can stretch or open up the space in there for the nerves a little bit. So I usually tell patients to think of my fingers as the nerves. As we get older, it's starting to close off a little bit. Probably not going to be able to open that back up to an 18-year-old, but if we can just give those nerves a little breathing room in there, you'll feel a lot better. So this is one way to help if it's coming out of the back, and I'll show you a couple other methods. Come with me. So over in this corner by our physical therapy area is our high-speed vibration plate. So what this was originally developed by NASA engineers to help stimulate the bones in space, and what it can do is also stimulate the nerves. So the plate moves very quickly, give me signals into the nerves and help them regenerate or heal. So really the neuropathy is damage to those nerves, where this can help regenerate. So if it is coming from the back, we can take some pressure off the nerve in the back, and then have this help regenerate the nerves. If you don't have the back issue, we don't need to do that. We can do right on the vibration plate, and that can help stimulate the nerves. So there's different pads, different settings, but basically you just stand on that, and the high-speed vibration goes on, and it's going to stimulate the nerves in the feet all the way up. You can feel quite a bit of vibration that's able to stimulate those nerves. So that's another part of our protocol, and we're going to come over here and show one more thing we can do for you. So here's another one of our treatment bays we do. And one of the last things that we do for neuropathies is a cold laser therapy. So it's going to use a light, as you can see there. You don't want to get this in your eye, but there's a light that can help stimulate the nerves in the feet as well. So laser penetrates up to 5 centimeters deep. Things like muscle stim and ultrasound just get a little 2 centimeters deep. The laser is able to penetrate a lot deeper, help stimulate the nerves to help heal them. So a pretty unique protocol with spinal decompression, high-speed vibration, and cold laser can really help with nerves. Another thing we offer at the office for neuropathy can be acupuncture treatment, can be very successful and help with the nerve pain as well, using very fine needles that you can barely see to do that as well. So hopefully I answered your question about neuropathy, and give us a call at 908-813-8200 or online at Hackettstownfamilyclinic.com.